Hello friends, today we will be discussing about aging changes of the face and its correction. Now, it's not the audience like you who are interested to know more about it. We have a big staff spread out in different centers, and they also needs to be updated regularly, educated regularly in order to get the right kind of information and pass the same information to the patients who come to our center. So today's session will be education for you as well as my staff who are sitting in front of me. So they are regularly updated with the procedures that we do, the steps that we follow, so that they can make the patient understand better, which is very important, because we give a consult for maybe 10 minutes, 15 minutes, 20 minutes, but the patient is still apprehensive about the overall outcome, results, lot of questions are there in their mind. So they feel more comfortable to discuss a little more freely with the staff, and therefore their knowledge becomes very important. So our today's session, the goal will be to educate you and to our beautiful staff. So it's a updation of the knowledge that we already have. Now today's session we are focusing on face aging changes and how we address mainly the facelift procedure that we are presently talking about. So if you see a lady who comes in the age of 50s or 60s, so what we will find that there is a lot of sagging of the face, sagging of the skin in the face. As you can see in this lady, the sagging has taken place in the mid face and the lower face, and also in the temporal area. Now her concern is mainly in the mid face and the lower face and the neck. What we see here is a significant drop in the malar fat, and there is a jowl in the lower face region. So we are seeing a prominent nasolabial fold, we are seeing a prominent labiomental fold, and the neck angle is blunted because there is a lot of skin laxity in the neck region, right? This is neck region, the jowl region, and the cheek mount. These are the three areas where the sagging takes place. Now sagging is happening because of gravity. One, gravity means wherever the pull is down and all this facial structure is gradually getting pulled downward, and therefore the ligament that is supporting the facial structure in the young age, those ligaments become loose day by day, and as you age by 40-50 years, they become significantly loose and you end up with having this kind of changes. Now one is sagging because of gravity, another is because of aging, the ligament itself become not that taut, not that rigid, so they gradually become loose and they also contribute to the folds. So coming back to the picture again, so what we have a significant mid facial sagging, lower facial sagging, and neck sagging, which is contributing to the obliteration of the neck angle. Now how do we treat such patients? So traditionally we have multiple options. Most of the centers that have non-surgical approach will go ahead with thread lifts, fillers, and other non-surgical tightening method like thermage or radio frequency. But in this age group where the significant sagging has already happened, the ideal procedure is a facelift procedure. Everything will contribute to the lifting effect a little bit, but if you want to get the best change, then facelift becomes a procedure of choice, because the one-time procedure, once the patient gets it done, she is at least get corrected for 10 years, she will not have any problem, she will maintain this result for significant number of years, which is very important for her. So non-surgical procedures are there in the basket, but when we talk of the best procedure, facelift surgery is the best looking procedure for getting the best kind of result. Non-surgical will give you a fraction of what we can achieve of in facelift surgery. So non-surgical is okay. Somebody who is totally against surgery, but surgical has to be emphasized to the patient so that they has to be well informed. Most of the patient doesn't know whether surgery can give you this. They are mainly flooded with knowledge about non-surgical stuff like thermage, UL therapies, which give you just a small fraction of what the facelift result will give you. Okay, so our goal is to educate the patient and make the patient take the right choice and select the procedure. Right choice means the best result for that money they are spending for the treatment. You can give a little result, but that's not the best result, and the recurring cost also have to be taken into consideration whenever you are taking a treatment. So facelift surgery is very important and is underdone surgery. People don't get it done because of the lack of awareness. You have to know about the procedure because it's a very gratifying surgery and this can bring about a huge change in the anti-aging option. Now in facelift surgery, what we do, our goal is to not only lift up the tighten of the skin but also the underlying structure, because just pulling up the skin will not sustain it for long. It will again sag down, okay, because skin has its own elastic property. It will again loosen up and sag down. So what we have to do, we have to tighten up the underlying supporting layer of the skin, which is the SMAS layer. So this is the facial skin. We have an underlying SMAS layer and below are the structures of nerves and vessels, okay. Now when we are talking of the skin tightening, we are not only pulling up the skin, we are also tightening the SMAS layers. The skin along with the SMAS is pulled up, so we have to address both the issues. We are not just focusing on the skin. Any other procedure only focusing on the skin, but in facelift surgery we are focusing on the skin as well as the SMAS layer. Both are getting pulled up. So the result is sustainable, it's long lasting, okay. So that is the bottom line. It's a long lasting best result for a anti-aging procedure of the face, okay. Now patients mainly comes with the apprehension of the sequelae, complication, the how much time it will take to recover, how much time at home. So all those things is back of their mind and they try not to go for the surgery. So if we can explain them that the post-op sequelae is okay, good and you can recover fast, then patient will automatically select the procedure. It's all about awareness. So it's all about awareness. Why US the people are getting more facelift surgery? Because they are aware that this is the best procedure. In India the awareness is very low. So we have to make the people aware of what surgery can give you what procedure can give you what, okay. So not that we don't do thread lift, we don't do thermage, we don't do the radiofrequency, all therapies, we do everything, but we have to give the right treatment to the right group of patient, okay. So bottom line is selection of the procedure is very important. It's not about surgical, non-surgical, it's all about the best procedure for that age group of patient, okay. So now what we do in a facelift surgery? Facelift surgery is a surgical procedure. First of all, that means the patient has to be under anesthesia. Anesthesia, generally we do facelift under local anesthesia with a little sedation. Sedation makes the patient a little drowsy, so the local anesthesia that we work on for the pain relief is manageable by the patient. If the patient is very apprehensive, very sensitive, then we give the option of general anesthesia as well, but most of our patients do perfectly well with good sedation and local anesthesia. So our approach is first to mark out the incision line where we incise the skin so that the pull is maximum, right, and the incision is hidden. So first of all the pull has to be in the right direction and we have to hide the incision in such a way so that it doesn't show in the face, which is a very important concern of a patient, whether the scar will show, whether the scar will show. That is the only point that the patient will question and then again and again. So we will try to make the scar almost invisible. How? What we do, we give the incision line behind the hairline, okay. The temple is this is the hairline of the temple coming onto the side one, right. So we'll place the incision behind the hairline, okay. Then bring it in front of the ear, and as we come in the ear area, we'll place the incision behind the tragus, okay. If you place it in front of the tragus, the incision shows. If you place it behind the tragus like this, then the incision doesn't show. So then you bring it down to the lobule, then it goes up. So incision line is just in the lobule area, which is also a crease, you know. If you see the lobule area in front of the lobule, there is a small crease. So incision line is just in at this lobule crease, which is almost invisible, and then it goes back to the mastoid and back of the scalp here, occipital area. So it's almost invisible scar. Any surgery will end up having a scar line. Our main emphasis will be to hide that scar line so that it's not visible, okay. So if scar is not visible, then the purpose is solved, right. So we are keeping the scar line almost invisible by this kind of skin incision that we are giving. So its cut may be very long, but it's an almost invisible scar because it's partly hidden behind the hair, partly behind the tragus, and all behind the ear, okay. So facelift surgery in terms of incision is almost an invisible और नॉन कॉन्स्पिकुअस इंसिजन लाइन, मतलब ये स्कार दिखता नहीं है, अगर स्कार होगा भी विजिबल नहीं होगा, दिखेगा नहीं, ओके. सो मोस्ट इंपॉर्टेंट आपको समझना है, पेशेंट को जब भी आप एम्फेसाइज कर रहे हो, आपको बार बार बताना है, स्कार लाइन होगा बट वो दिखेगा नहीं उतना ग्लेयरिंगली. और मोस्ट इंपॉर्टेंट, गर्ल्स डू हैव ए साइड बर्न, द हेयर स्टिक्स आउट. सो अगर थोड़ा भी हेयर्स रहेगा तो that nobody can make out. So scar line is not an issue. Now coming to the point of surgical maneuvers, what we do, so that आपको समझना चाहिए why it is long standing, why it is sustainable over the years, because we just place the incision. For placing the incision we give the local anesthesia, we give the incision, then we raise the skin flap. ये skin को हम will raise the flap of the skin, then उसके नीचे, that below the skin will have a SMAS layer. SMAS layer, then we work on this mask layer. There is a particular maneuver which is a part of the deep plane facelift where we try to elevate this mask layer above the parotid fascia. Okay? The facial nerves come from the edge of the parotid gland medially. So facial nerve, जो main problem of main complication or the difficulty in facelift surgery is the facial nerve preservation. So that no sequelae of the facelift surgery. So we try to raise the facial skin, then take out the SMAS layer up to the edge of the parotid fascia till the facial nerve comes out. That is the safe limit. Then the dissections become a little more accurate and tedious, where we don't damage the facial nerve, we just elevate the SMAS layer till the point the lifting effect is obtained. That means the jowls and the cheek mound of descent has been addressed. Then we come to the lower down, जहाँ पे SMAS layer is extending on the platysma. Platysma is the neck muscle, superficial neck muscle, which when you grimace you see this tightening, right? This is the platysmal bands that you see. So this is the face, platysma is extending to the face. So we elevate this SMAS layer up to a certain point, then we elevate the platysma, then we have to do some kind of maneuver in the platysma and pull it in the back limb and in the front limb to make a good neck contour, which gives a very nice neck contour, and the upper limb of the back cut will give a very nice vertical lift of the face. Okay? So these are the three maneuvers we do: elevate the skin, elevate the SMAS layer up to a point where the facial nerve is preserved relatively well, then we work on the platysma, again taking care of the nerves, okay? Then we elevate it by giving back cut to both the direction. Before that, we will also do a little bit of liposuction in the submental area. Most of the ladies will have a little bulge out here. It will not only take out the little fat that we have, but also it will give a plane of dissection. Sometimes the platysma is also, there is a gap. When we grimace, you see many times there is the platysma doesn't fall back nicely. So we might have to work on the midline platysma also to give a nice contour of the neck angle. Okay? So these are the basic steps of facelift surgery. Now facelift surgery is done in locally, it takes around 3 to 4 hours. Patient is put on a small drain that is taken out the coming day, and the swelling generally is not much. Second, third day swelling is maximum, then it comes down. By 2 weeks time, swelling is significantly decreased, but the swelling to completely go off takes around 1 month to 3 months time. This is the sequelae of the facelift surgery. The additional, sometimes we patient might need a lower eyelid blepharoplasty surgery along with the facelift. Sometimes the patient needs a little upper eyelid blepharoplasty surgery to give a complete anti-aging changes of the face. Okay, this is the broad overview of the facelift surgery. Now I will just share with you the picture of the same patient who has been done a facelift. Okay, any questions you have, anything you want to ask? कुछ questions हैं आप लोगों का पूछ सकते हो which is bothering you. So देखिए, this is the post-op result of the same patient. What we have done, the nasolabial groove is taken care of partly, the jowls has been pulled back, the neckline is finely obtained, and the scar line is hardly visible out here. This scar line is behind the hairline. Okay. Now I will again show the pre-op. So this is the pre-op, and this is the post-op. Okay. So this is the post-op, this is the pre-op. Can you appreciate the change? This area all has been pulled up. The neckline is very important. Just have a look of the neckline. Now this is just a 3-week follow-up. The swelling will further improve over time. Okay. This all swelling is there. This will all improve. the neckline is nice, the jowls have been taken care of, and there's significant anti-aging change of the face. So this is what we get in a facelift surgery. So I know you are little apprehensive about questioning, but जो questions आप लोग मुझे generally पूछते हो वो ये होता है स्कार लाइन दिखेगा कि नहीं दिखेगा, सबसे important, ठीक है, कोई कॉम्प्लिकेशन है कि नहीं. स्कार लाइन ऑलवेज स्कार लाइन कॉस्मेटिक सर्जरी में होती है. स्कार लाइन हम ऐसे प्लेस करते हैं वो दूसरों को दिखेगा नहीं, क्योंकि हम हिडन तरीके से उसको प्लेस करते हैं या क्रीज लाइन में प्लेस कर देते हैं, सो दैट इट लुक्स लाइक ए क्रीज लाइन और इट्स नॉट विजिबल इन फ्रंट ऑफ योर आइज. ठीक है, ये दो आपको पॉइंट याद रखने हैं. सेकेंडली पॉइंट, व्हाट पेशेंट कॉम्प्लिकेशन क्या है. कॉम्प्लिकेशन हो सकता है अगर आप इनएक्यूरेट सर्जिकल मैन्यूवर से फेशियल नर्व ब्रांचेस की डैमेज हो सकती है, बट उतना हम एक्सटेंसिव सर्जरी करते नहीं हैं जहाँ पे फेशियल नर्व डैमेज हो. हम उतने आगे तक डिसेक्शन प्रोसीड नहीं करते. वी ट्राई टू लिमिट द डिसेक्शन जहाँ तक फेशियल नर्व डैमेज ना हो. राइट, ये इंपॉर्टेंट है. काफ़ी बार क्या होता है ना, इफ़ यू आर नॉट डूइंग दी टेक्निकल पॉइंट्स आर नॉट फाइन, इफ़ यू आर नॉट एक्सप्लेन, देन ईयर लॉब्यूल थोड़ा प्लेसमेंट गलत हो जाती है सर्जन से. तो ईयर लॉब्यूल की जो शेप है वो भी बहुत इंपॉर्टेंट है. तो इसमें सर्जिकल टेक्निक फाइननेस बहुत मैटर करता है. सो दिस इज 2-3 पॉइंट्स यू हैव टू रिमेंबर. ब्रूजिंग आएगी, ब्रूजिंग विल टेक अराउंड 2 to 3 weeks टाइम्स टू गो. स्वेलिंग विल टेक अराउंड 3 to 4 weeks टू गो. कोई इसके अलावा थोड़ा सा नमनेस रहती है एट दिस स्कार लाइन अराउंड द लाइन ऑफ द इंसिजन, वो नमनेस भी आहिस्ता आहिस्ता खत्म हो जाती है विद इन ए मंथ to 3 months टाइम. दिस इज ए ब्रॉड ओवरव्यू ऑफ फेसलिफ्ट सर्जरी. बट सबसे इंपॉर्टेंट है, वी हैव टू गिव द इंफॉर्मेशन टू द पेशेंट. हम इसके बारे में जिक्र ही ना करें ये गलत है. पेशेंट हैज टू बी राइटली इन्फॉर्म्ड that these are the non-surgical, surgical, both the option exist and which can give you what, right? Which can give you what? Then the patient should select. ठीक है, I can go for the surgery, I may not be going for the surgery. That's the patient to decide. But information has to be passed on so that they benefit the most. Patient has to benefit the maximum. Okay. So this is the today's topic. We'll come out with a detailed operative surgical video of the same procedure in coming up video session. In case you have any doubt, any questions, you can write it in the comment box. We will be very happy to give the reply. Okay. Thank you so much for watching the video, and we will continue the same medical education in coming months.